we lost track of the time, so we're starting a little later today. We're recording? All right. Good afternoon. Welcome to the official meeting number 13. Is that it? 13? Of the, thank you, of the Technical Working Group for the Broward Safety Action Plan. I got a copy here. Yeah. And yeah, we thank you all for being here. We have what we hope will be a very interactive agenda. Let me run through it real quick. By the way, I'm James Cromer. I'm project manager for the MPO on the Safety Action Plan and one of the deputy executive directors. We also have Minteng Lee, who is the deputy project manager on the county side. Going through the agenda then, today we are going to talk about the BSAP executive plan that went out for review at the beginning of March. And we want to just walk through it with everybody here so that you're familiar with what it is and what it isn't too. Then the first interactive feature will be Fazil taking you through the safety dashboard. Some of you have seen it, Eric and some of the others. And so we think it's a great tool, and it's going to be available soon on our website. We'll build off of that then to talk about, once we have the safety action plan ready, how do we move forward with adopting it at different levels of government? And so I've primed a few of you to think about, what does the safety action plan mean for your organization? How can it be of use? And then we also want to talk about our path to implementation. We have a bunch of projects, and there are details in how each of those projects will move forward to actually become reality. So we want to talk a little bit about what that means at different levels and different funding sources. Online today, we have Sasha Lovello and Desiree Curry, both from Broward North Health. And for both of you, Sasha and Desiree, we're going to ask you also to think about what the adoption or how you would use the safety action plan. So we'll get back to you on that. We're going to start today then with my portion of the agenda, then talking a little bit about the safety action plan. Before we get started, does anybody have anything pressing that they want to share with us? No show and tell, nothing to. Okay. All right, we'll keep going then, and we're going to pick on some of you in different ways. So we've talked a little bit about the agenda. I want to then go through what the safety action plan is. This is a presentation that I did to the Technical Advisory Committee and Citizens Advisory Committee, and also will be presenting to the MPO board in April. We didn't have a meeting in March with our board, so this will be the first time that they're going to be seeing it. To familiarize everybody, the Safe Streets for All grant is, you're here representing Tamarack today, right? Yeah, so if we could get him signed in. Safety action plan, 3 main components at the top. We have a data-driven plan that is based on information that we have, and being aware that it's the information in its imperfect state, and there's also things that we don't know. An action-oriented plan so that we're moving forward to implementation. That'll be the last part of our agenda. And then a plan to reduce severe injuries and traffic fatalities to 0. So we'll talk a little bit more about that goal. We've talked about the funding, the $5 million, and Broward County kicking in with a local match. And then the 3 main outcomes are creating this action plan goal with a date and a number. We want to identify projects, prepare them for funding and implementation, then also policies and programs. And so we'll be talking, I think we're at the point now where we're wrapping everything together in a package. So that's great. The BSAP executive plan is a streamlined version of what we will expect to be the full plan that will come around in September. We have decided to pursue getting MPO board approval in April, so that our local partners can qualify to apply for funding through the SS4A program in this current cycle. The notice of funding opportunity has not come out yet, but we're expecting it before the end of March, so countdown is progressing. And with that will give us details of deadlines and such. But if we're proceeding based on last year's deadline, we would have needed to have the plan approved by April 30th. So we took a course of action to do a streamlined plan. It is very tight and concise. The direction from our executive director was created in such a way that our board members will actually look at it and read it. So there's a lot of information in there, but there's a lot of stuff it doesn't contain. And so some of the comments that we've received on the plan are concepts that we will move forward as we go forward for the full plan and with more details in there. To comply with the federal requirements for SS4A funding, we need to have an eligible plan that meets these items on the checklist on the right column. And so the second page of the document shows these different checklist items than the pages of the document that they apply to. I want to draw your attention to number 5, demographic considerations. That used to be equity. We're waiting to find out what the new requirements will be for that. So in the exec plan that we created, we took out a lot of the equity information, and we'll wait to see what terminology is appropriate and what we need to include in that plan. But the other components are in there. And so I'm going to walk through with this slide presentation one by one each of these elements. First element is, or the first component is a leadership commitment and goal setting. And so that involves getting official approval from an organization or a leader. So that's going to the MPO board for approval. We will hope, and we'll talk to you a little bit more about how we would seek approval of the plan from our other partners, such as Broward County and at the local level. But to qualify for the grant for future funding, we need to have MPO board approval. And then the goal setting, we have set the goal of the target year of 2050 to achieve 0. This is in line with the goals that are in some other organizations nationally and in this South Florida region. And then this holistic approach, the consultant prepared this graphic on the right, the path to 0, to show that it's a multifaceted approach. It's not just one solution that will get us to 0, but it'll be large-scale capital improvements, some smaller items. I'm trying to read this, reducing VMT technologies and speed reduction strategy. So a variety of things will work to get us to reduce our KSIs, killed and serious injuries, down to 0. Second element is a planning structure, and you are part of this. We needed to have a group that represented a variety of perspectives from the community. So not just the typical transportation people that we speak to, but we also reached out to health industry, law enforcement, private sector, community champions. And so you, as the technical working group, meet monthly, provide more detailed guidance. There's an oversight committee that meets quarterly, and they provide a higher level direction for our activities here. We had to do a safety analysis. So if you'll recall, we did looking at Signal 4 data and developing a high injury network and also a high risk network. And that proved to be the foundation for some corridor prioritization, where we identified 11 corridors to move forward for concept design. We've also done focus plans in 8 different areas, and those also tap into the safety analysis and look at things in more specific manners, such as the lighting plan or the school zone plan or the neighborhood safety, things of that sort. And so all these things then have combined to develop recommendations for policies, projects, and programs. We needed to identify the next component is policy and process changes. And so we've looked at how these potential changes fit into a safe system approach, which was a direction that we provided. And in case anybody's wondering, the exact wording changed in January, I think. So it's no longer safe people, it's safer people, safer vehicle, all these things. It's slightly different, but the same general concept. So it's trying to make things better than they are. I don't know if you want to add anything, Carrie. You're nodding your head. Amazed. Yeah, it's curious, but it's a slight difference, but it's however good you are, you can do better. So, okay. We needed to identify strategies and project selection. So we'll be talking a little bit more about some of the projects that were resulted from the 11 priority corridors and also the different focus plans. We wanted to make sure that we identify some funding opportunities from a variety of sources at federal, state, county, MPO, local, private, and then also who's responsible for the implementation. So this is an example, very high level, of some recommendations from the rail safety plan, and there are much more details. And this is also a good example that in the exec plan, it's not going to show all the details, but we do have all those details available, and will be appendices to the actual report. We need to demonstrate engagement and collaboration. And so we had a 4-phase approach where we started off the first part of last year doing education and awareness. So we had social media feeds, different things that talked about statistics about safety, but also tips about how to drive or walk or bicycle more safely. Then starting in August, we did our first round of outreach, going out to the communities. public meetings based around the 11 priority corridors. We then did an analysis to see how well is what we are doing working. And so we did some adjustments and tweaks. And then this final part is, again, going out to the public, but doing also, in addition to the workshops based on the corridors, we want to do a series of road shows. Talked a little bit to Leah, and from all of you, we'll do some outreach to find out if you will be having events where we can piggyback and come back and bring a safety action plan table or different activities to your event. We want to reach out to large segments of the community. We also anticipate doing some technical training, so developing an approach similar to what we did in January last year, where we can focus on what does this mean to you as transportation professionals. There's different levels of conversation for different people. And then finally, the last element that's a component of an eligible safety plan is progress and transparency method. So we've talked to you a little bit about having this process to monitor the results and our milestones. It's going to be twofold. Let me hit the report card first, where we need to report back annually to our federal partners the progress that we expect and plan to make in terms of improving safety on our roadways and looking at a variety of different metrics. And so we're going to build those off of the safety data that we have, and then also monitoring how well we're working toward implementing the recommendations. The second thing we want to highlight is our safety dashboard. And this is where I'll call Fazil up to share how the dashboard looks. I think even this version is this slightly different from what the reality is now, Fazil? You will let us know. So do you want to do that from your chair there? Or? Okay.
Let me make sure this works. Okay, so everyone obviously remembers our website, right? SafeStreetsForBroward.org. Yes? Of course. Okay. All right. So let's see if this pops up. Okay. So hopefully by the beginning of next month that you'll be able to access our safety dashboard by going to our website and clicking over to safety dashboard. If you try to go there now, it says it's coming soon. Okay, so this is how our safety dashboard is set up for now. It's not completely finalized at this moment. There is some tweaks that are going to occur between now and the end of the month. That will hopefully provide some additional tools and data that could be helpful. But the intent of this dashboard is once a year as part of our as part of the Broward MPO's annual safety reporting, we're going to go ahead and upload the previous year's data into the dashboard. So this data that you're going to see here, it's data that was only processed one time. We're not going to continuously process it on a year-to-year basis. That's what Signal 4 is for, right? Because that data can, in theory, continuously update. So when you get to this dashboard, you will see on the left, you have all your filters. In the middle, you have your map. On the right and on the top and bottom, there are different types of statistics and charts. And if we start with the map, for example, you'll see that you see these great little squares, and there are version of the heat maps. And as you zoom in, the legend changes. So now you're able to see not just the hot spots, but you'll see some of these icons here, which these icons are the different transportation or the different transportation modes for KSI crashes. And the blue dots here, the lighter dots that don't have any symbology, those are the non-KSI crashes. So when you click on any one of these, you'll see there's a plethora of information that pops up here on your right side. I can hopefully give you a little bit more information of what you may need related to that specific crash. And the same thing happens for the non-KSI crashes. The same data is also available here. And we just want to continuously stress that this is a great starting point that you all can use without having to go into the nitty-gritty of going to Signal 4 and extracting that information. That this data should at least provide you somewhat of a good starting place. Okay, so on the right here, there's going to be more charts that are going to be displayed, and there's going to be more tabs. So as you click on the tabs, you'll see that that there's different forms of information available. And now over here on the top, These are all the KSI crashes, all the KSI crashes for now, that are on Broward streets or non-interstate highways, interstate highway crashes, as well as private parking lots and private roads. So if we want to just switch this over, and hopefully you'll be able to see, cool thing about this graph is that everything in theory should get updated. So if we just do non-limited access crashes and we just take out the parking lot and private roads, you'll see all these statistics around the screen also update. We did go ahead and put in some other filters, like if you wanted to look at your own respective city, we'll just go with someone from Deerfield Beach here. It'll also do a heat map for your city, and if you log in or scroll in, it'll just show you the crashes related to your city, but it'll also update all these other graphs. So hopefully this will provide some form of insight for your own use. We are looking at, like I said before, we are looking at doing some other types of, or providing some other forms of data. Like here on the right side, these are all the different types of injury classifications for different crashes. And as we know, fatal and serious injury crashes only account for 2%, so it's a little bit hard to see those. But if you go ahead and go to the crash severity filter here on the left, you remove those, you'll be more easily able to see it. And don't worry, this is not going to be dark gray once we release this. It's also difficult for James and I to see this. So we're gonna try to add a little bit more color to our crash dashboard, and this is what we're hoping to use to do our annual reporting for the oversight committee. That's gonna probably meet one to two times a year. So we can report our progress. Now with that, does anyone have any questions? Is there anything you want to pop up? No, Mike, please. Scott, Mike.
Hello.
Yes.
Is this going to be updated as new years of crash data come out?
Yeah. So for instance, so the only data that's in here right now, it's from 2018 to 2022, which is what we use for our safety analysis. In the next couple of weeks, we're going to upload the 2023 data since we already have it processed. And then, for instance, later on this year, we're going to be looking at adding the 2024 data into the crash dashboard as well. But we're not going to go back and reprocess the older year data. So you will see that there might be a slight change in the type of information you get between Signal 4 and our crash dashboard.
And I want to add to that. We've looked at different dashboards from across the country. Some places update it on a weekly or if not daily basis. And that requires a certain dedication of resources. Our practice has been to take the Signal 4 data a few months after the end of the year so that gives them time to sufficiently clean it and make sure that it's processed properly. So that's typically going to be late summer by September, and that's an annual cycle that the MPO has followed in the past too. So, and then we will add a marker. It says on the top of the left column there about the date, so it'll say this information covers these years, and we pulled it on September 25, whatever it is.
So I have a question. So at what point will you have a constant window of crash data in it? I mean, we're not just going to continue to add year after year to this, or are we?
That's the requirement of the grant. That on a yearly cycle, we have to report crashes or report on our performance measures. So the process for cleaning this data is already part of a process that we already do as an MPO to fulfill our safety performance measures for FHWA. So we're just piggybacking on it and just going to use that data and input.
Let me clarify with Jonathan too. Are you asking, we'll probably typically have a 5-year window. Is that what you were thinking?
Okay, so I guess my follow-up question, a better question, I think, is does the user have the ability to select what years?
Yes.
Okay, so I can take out old years, right?
Correct.
Years 20 years ago.
Correct.
Okay, gotcha.
So you can go here to the crash here filter, and if we just want to do, I don't know, just want what happened in 2020. You can click that and everything will update and you'll only see the 2020. The
Thanks.
only crashes you'll see is the 2020 crashes. God, do you want to say something? Okay, okay.
Will you
And
be able to filter by the municipal service district as well?
Yes, I actually believe we do have that here.
Okay.
Let me see.
Yep, it should be there,
Just let me see where it's at.
down at the bottom.
The BMSD, right?
Yep.
Yep. It's here too.
And go ahead and click on the county regional facility because that data comes that way through Signal 4. So there's the BMSD, which is the unincorporated areas, and then there's the airport and the port. And I can't remember if there's any of the landfills are in that too. Looks like just airport and ports. Oh, almost too far out. Oh, you went outside the urban boundary. Yeah.
Oh, well,
That's curious.
this is something that I just learned, that you can click on the hotspots. And it gives you kind of like a breakdown of what's in that square.
Eric? I guess, having looked at it now, have we ascertained, say, where the most dangerous places are in Broward County, or highlight that?
You want to recite some of them?
Sure. I mean, we have the top 20 most dangerous intersections identified in the Broward Safety Action Plan. We did the prioritization that's in the Broward Safety Action Plan of all the corridors that are prioritized based on not only the crash data, the historical, but also the risk and then the, dare I say, equity. So based on those things, we did a prioritization matrix. So we have all of those done. This tool is a little bit separate than giving you a list of projects. So if you want the list, Eric, you have to go to the plan. But if you want data and kind of to be able to scrub the data however you want on the left, to be able to give you the outputs that you want, you can use this tool to do that. So if Deerfield Beach wants to go after a grant based on, I don't know, motorcycle crashes, you could click Deerfield motorcycle 2018 to 2022 city streets only. And you could have that data pop up. So you could use it for your grant application. That's the hope, is that this is a tool.
It's all fantastic.
Oh,
It's all fantastic. No, I was, there's been a few different times in the last year or so, where we've had a resident tell me that, like, their street's the most dangerous street in the entire city. And it's great to actually go to the map and go, well, no. But I guess, I was just looking, sometimes we all think we know where the most dangerous place is, but, did the data prove us right or wrong was more of my thought.
I'll just add that what's nice about this map is it's got all the crashes, right? So the little blue dots are crashes, all the other crashes, but then the icons are killed and serious injury crashes. So your neighbor might say, oh, we have a lot of deadly crashes, and you can go to the map and be like, actually, there's been no KSIs, but there's been a lot of property damage or possible injury. So I think that's a good discussion. You could even send them this if you want and be like, check this out as a tool. They might get even lost in the data and not call you back.
And I saw somebody else with a hand up too. Paula?
Yes, so I know that, of course, the rail data, it's not easy to capture. But how is that is that a requirement as well of the grant for the rail data to be captured as well? Sort of real time?
So it is not a requirement of the grant, but we are going to be tracking it. One thing about this data is that it's kind of formatted in Signal 4's world, right? And the FRA data and the train crash data, it's documented differently. So for our performance measures, we will be on a yearly basis, not uploading that information into here, but we will be reporting on it on that yearly, dare I say, report card for now, for performance measure.
And one of the issues with the FRA data is it categorizes the crashes differently, so it has fatalities and then injury. And this is broken down differently. And again, there were some other distinctions too. So we thought, do we try to make it fit in, but that would overly complicate the dashboard. So this is where the dashboard can do a lot of things, but it can't do everything. There were some other questions about at a city level, if they wanted to download the data for this section. And what I think the team is still looking at that, but what we figure we can also do is provide access through Signal 4. So the city could pull down the data for a particular area and category. This tool might help in some of the analysis and crunching some of the numbers, but somebody who wants details about the most dangerous street in the world in Deerfield or something, we can pull that out separately. Oh yeah, that's. Anything else? Anybody else? Okay.
Okay. All right, so I'm gonna unshare Miguel.
I think they all just want to be able to dive in there and play with it themselves. When we first saw the beta version, I called several people into my office. You got to see this. This is so cool. So we're anticipating a lot of interest and interaction. So the dashboard, we wanted to show you that as part of our, what's our category? The progress and transparency. So making the information available. And I think the SS4A NOFO talked about providing information on a publicly accessible website. So this will be one of the ways that we will do that. We sent out the BSAP exec plan for comment starting March 3rd, and we were taking comments through March 14th. And we shared this information with a variety of people. So we sent out information to our oversight committee and our technical working group, to our MPO board, the TAC and the CAC. We also took all the people who had signed their names, the sign-in sheets for our public workshops, and it went out to them. The MPO has a Mobility Monday e-blast that goes out every week, so it went out to them. We also talked to some of our different partners, like ITE. We'd done a presentation to them. We also did the city managers. So yeah, so we'll have to make sure we add that to the list. And so we got a variety of comments, total of over 400 different comments coming in from a variety of different sources. Fazal wanted to compare how we had done compared to some other places. I think Orlando, they had like eight different groups commenting. We had a variety of different comments coming in. And in summary, then we got a generally favorable response to the document, that it looked good, it's concise, it was generally easy to read. There were some concerns about how streamlined it is, and that's where I wanted to talk a little bit about how this is not the final. This is something that is complete and meets the components so that our plan will be eligible, so that our partners can proceed for applications for funding. But we do want to add more heft to it as we go through September. We'll work out a lot of the details. And so I know I've had some conversations and minting with our county partners about, let's get something that's complete, but we'll make it more complete as we go forward. There were a number of comments about looking at certain pages. There are so many statistics and so many pages. So making sure that what we call something on one page is consistent with what's on another page. So we're looking at that. There were some farsighted people that had questions about, this all sounds good, but how are we going to make it happen? Do we have the resources? Do we have the staff to make it? And so that's something that inspired us to have this conversation today about implementation approach, so that we're figuring out what do we need to do to move it from words on a page to improvements in the roads. And then we've had some conversations about the policies and programs. There are various pages. The initial version took recommendations from the different focus plans and compiled those. And we realized we need to treat those a little bit differently. And so we can talk a little bit more about that, I guess, as we go forward. But does anybody have any questions or any comments that they want to throw out now? Because the consultant team is now doing the revisions. So even though our deadline was last Friday for comments, you all have entree to give us some more if you have any today. Today expires at 4:30, so. 5 minutes? Wait, Eric, you gave too many. Eric's was about how many? You gave a lot, so that was good. Oh, thank you. Say that again. What was your question, Eric?
All my comments, that's all.
So this is not picking on you, Eric, but we appreciate everybody's comments. We appreciate their insight. We cannot promise to that we will incorporate everybody's comments. In part because sometimes comments came in contradictory to each other, you know. And also sometimes some of the comments will be, you know, somebody gave an idea. Okay, well, noted. We may be able to incorporate some of those comments as we move forward to the more complete version, or different things I was sharing one with Romari. We won't mention names, but somebody made a statement about BCT policy, and I thought, well, let me check with Romari. And so we weren't sure if, yeah, we're checking things, making sure that we're understanding what the comments are. Anybody else?
New comment. Think about like a one pager, you know, like, so not everyone is going to read it eventually, right? So if you had a one-page document, I think Fort Lauderdale did that, like a one pager that was just, you know, here's the best facts.
And we're going to touch a little bit on that later today. If you'll recall, was it last month or the month before? January, we talked a little bit about how we tell the story. And part of that is coming up with a cheat sheet or frequently asked questions. Metro Plan Orlando created a safety action plan guide for elected officials. And so it's more than one page, but it's very simple to look through. It contains some significant statistics and then some themes and approaches. So yes, we're looking to do something like that. And we'll talk about that a little bit more today. I'm looking a little to Christopher because Christopher was involved with our Metropolitan Transportation Plan, the 2050, and formatting and adjusting. And so that was a bit of the inspiration for us seeking a more streamlined approach, recognizing that, you know, a thick document, everybody should read and memorize every page. They probably won't. So let's get them something and then they can snag on the details that they like and find out more. Okay. Anything else? If not, then I have set the stage for Christine to lead us through a discussion of the path to adoption and then path to implementation.
Thank you, James. And again, I want to thank you for your comments for the plan. Appreciate it. I think we got comments from Mintang, Karen, Eric. Thank you very much. Much appreciated. I know. Yeah. So
No, give her the standard line. We appreciate your
we appreciate your comment. All right. So how do we kind of get this plan going, right? It's called an action plan because we need to take action, right? So our schedule, as James mentioned, is we're going to go with the executive plan to the Broward MPO in April 10th, if you want to join us. In September, the plan is to take the bigger plan to the Broward MPO to adopt kind of the amended plan, and then Broward County Commission to adopt it. And then in the fall, it's open to go to cities to adopt. The hope is that cities will adopt it so that you can go after more SS4A, hopefully there's more. So we'd love for you to adopt it. So let us know what you need in order to support that. So kind of a bigger question is kind of how can your agency use the Broward Safety Action Plan? We've got obviously all these partners. Law enforcement is a big partner because we can use those tools immediately to get safer speeds and better behavior, right? So how can law enforcement use the Broward Safety Action Plan? If you have ideas, like let's have a conversation. Health, I know we've got some health officials on the phone. Like how can this inform health and how can they give us information so that we can make better decisions?
And so we do have Sasha and Desiree from Broward Health North and then Rachel Solomon from Memorial Health, and want to prime them if they want to talk a little bit about how they might use the safety action plan. I don't expect that they have a board that would adopt this. And so if they can give us any perspectives on how they think it could be helpful for them. So we'll look to see on Zoom if they have any hands that come up or.
Yeah, and if you would like to speak, just please raise your hand online and then I'll give you the ability to speak. All right. Rachel. All right, you can unmute yourself.
Hello. I don't have a concrete way necessarily that I can say that my organization will use the plan. But internally, I plan to use it to drive my outreach and injury prevention efforts across the county. So I plan to use the dashboard and other resources you have to drive what I do in like on my own. But hopefully, I hope my organization will eventually adopt as much as possible. I'm not
Awesome.
sure how to, I'm not sure how to mute myself again after that. Hang on.
You're good. You're good. We are like what James stated, like we're gonna be looking at producing the frequently asked questions guide that could potentially assist you with the work that you do. We're also looking at potentially getting all of our social media posts that a lot of our social media posts and graphics have a lot of good statistics from our plan. And trying to provide that for your use potentially in the future, and it will be posted on our website. James, is there any? Oh, and then we're also going to publish all of our technical reports and whatnot, so you'll be able to grab whatever statistics and whatnot that you find helpful in there too.
And while we have Rachel and Sasha and Desiree, as we talk about going out to the community for road shows, I think we want to follow up with you on if there's an opportunity to piggyback and go in full force. I think all your organizations do quite a bit of outreach. So we'll see what we can learn and share with you.
Happy to help any way I can.
Awesome. All right, Sasha, I'm gonna give you permission to speak if you can just unmute yourself.
Can you hear me?
Yes.
Yes.
Okay, yeah, it's Desi and I were here. We kind of the same, that kind of piggyback on what Rachel said for Memorial. We do a lot of outreach, so I mean, we can take this information to our events that we do too, but we'd love to partner in any way and go out for the outreach. Social media posts from Broward Health we could do. There's the National Walks Safely to School Day on May 16th. Maybe we can piggyback in with that somehow. And then just educating when we go out to our numerous events.
Or
Say
even
that again. The May 16th date was National Wood.
National Walk Safely to School Day. It's throughout the entire country. So especially for elementary school children, we would go out to the school and plan with them for that day, so that they would be involved. All the kids who were coming to school that day and are walking would make sure that we would be at the crosswalk towards the school so that we could see exactly what their patterns are and maybe some education for their families as well.
Sounds like a great opportunity. We'll be sure to.
So that's throughout the entire nation. It's a national thing that for safety for children. So we have an elementary school just north of the hospital, or what is that? Yeah, just north of the hospital that we could work with.
Great.
For that thing.
If you think of anything else, just raise your hand too, but let's keep going.
Okay.
It can be different from different organizations.
Transportation agencies, of course, that's the folks in the room. Broward County and MPO obviously have boards that can adopt. Municipalities have city commissions and councils that can adopt. I think one outlier is FDOT. Is there a tool where you could adopt the plan or commit to the 2050? So I think that's a question. I'm not sure if Scott and Jonathan can answer that question right now, but is there a function where you could adopt a goal?
And Scott and I were talking a little bit before the meeting, so You got some of the answer, right?
Yeah. You have DOT's full support in trying to make Broward a safer place.
Mhm.
But there's no official we do all kind of planning studies and we don't officially adopt them at the end. Management will make it known to employees that this is a priority and we should try to incorporate these improvements. But in terms of policy, there's no action a board is going to take to adopt it.
Right.
But I want to assure you, and I know you already know this, even absent that, it doesn't mean we're not committed to the plan. I mean, we're committed to the plan even absent that. Do you agree with that, Jonathan?
Yeah, in general, I do. But I also think that we have teams or programs like scope refinement, for example, in our planning unit that can help, refine scopes to add features, safety type features that would be advocated in such a plan, in a plan like this to specific projects. So we could bring that back to the office and say, hey, why don't you guys take a look at the BSAP, and use this app as in a routine way, integrate it into the day-to-day activities when trying to refine scopes of our different projects. That doesn't guarantee it's going to get in there because it takes funding, of course, but it is definitely another tool that could be used to say, okay, here's a project that's on the network that we've been talking about here, the scary network. So seriously give consideration. It can really help justify adding cost and work to a project, to a 3R project, for example, which in recent times we have really been scaling back the extras that we've been putting on, just financial reasons, frankly. But this can certainly help, I think.
And Scott, you had mentioned that there may be some different ways. I appreciate Jonathan talking about how the policy, it's not necessarily an adoption, but incorporation of policy into projects. And Scott, you were talking a little bit about some different ways that you think that could move forward.
That was the project specific ways. So I answered the policy, which is maybe not what you wanted to hear, but in fact, I
We
even
wanted
thought
to
of
hear the truth. Yeah.
the fourth way. So there's 4 project specific ways that I'm aware of that some of these improvements could be made. Way 1 is the Broward MPO prioritizes a project and DOT funds it off your priority list.
Yep.
Way 2 is we look at the 5-year work program and we find projects that are already programmed and we see if we can incorporate some of these improvements. Way 3 is if we believe any of them would actually have through safety funding, if they would generate a BC ratio, of this improvement, it could qualify for safety funding. And way 4 is internally DOT, we have what's called a new projects request meeting once a year. Everybody comes and just pitches ideas. Now there's a lot of competition for very limited funds, so don't hang your hat on this one too much. But we could come and say, hey, look, we think this is a priority. We'd like to pitch this one for district only funding. Most of those other ways that I said have a different source of funding. The MPO obviously has funding. Safety is a different funding category. What was my second way? My second way was a project that's already programmed. The new projects request meeting has got to be like leftover district funds that aren't already committed. So it's a fairly small pot of money, but off the top of my head, those are 4 ways that these could get funded.
Excellent. Next on the list is transit providers. Obviously, I guess correct me if I'm wrong, BCT falls under Broward County Commission, right? So it would come down from the commission adoption. Rail owners and operators are obviously a big partner. So I guess, Paula, you're representing today the rail. You have your own board.
Right. I think we have on the 25th of March is a planning technical advisory committee. I believe the BSAP is supposed to be presented there. That's what I was told.
Oh, for the TAC meeting, right?
Oh, is it okay.
Yes, the TAC meeting's on the 25th, right, James?
Right.
Well, the Broward MPO TAC is the 26th.
Okay.
So I know SFRTA has a PTAC.
Right, so maybe it's two different meetings, but I was
Yeah.
told that it was being presented.
We will gladly go if you, I mean, yeah, just let us know.
But I mean, as you know, that's what I was told just before coming here, that it was. Yeah.
Well, and let me use this as the avenue to talk about this, that it's all tying into implementation and adoption, but we're anticipating that at our local level, Rick and Eric and Karen, with some of the cities that have projects on our priority corridor list, we would go to the city, and before those projects could move forward in our MTP, we would need a resolution of support from the city. That might be something for SFRTA, as we're talking about some of the recommendations from the rail plan along the SFRC corridor, that the SFRTA board could look to provide a resolution of support for that. In addition, though, there's, and Christine will talk about it a little bit later, but we're thinking the resolution of support for a project and adoption of the safety action plan could go hand in hand. So a commission could do one or both together. So that's something that we'll talk about a little bit more, but I wanted, you know, like Rick, as we've gone and met with the City of Hollywood Commission, before the recommended project on TAF goes forward, we need the commission support and blessing. And so it may be a chance to get overall plan adoption too.
We'll have to, excuse me, enact a resolution for that sort of thing. What sort of time frame would we need? Because it takes a little while to get one through our conveyor belt.
Yeah, okay, we might repeat some of this stuff later, but as we're preparing to get projects incorporated in our 2050 Metropolitan Transportation Plan, there, and maybe Christopher, you might correct me if I don't get the details right, but there's a holding area for projects that will come from the Safety Action Plan. And we expect to add those through an amendment process where we would know to have that in place by November to then get that on the list for this next year. There's a lot of projects too, so we understand that not everything will go forward the first year and could always go forward the second year. And then it becomes part of so it's an amendment to the MTP, and then we put it on our list of prioritized projects in January, February, which then goes forward to FDOT, which then they can assign funding in the draft tentative work program. So there's a process and a cycle there. Eric?
Well, two things. Right now it's Broward days. I don't know if anyone at MPO goes up to Tallahassee.
Yeah, I think we have a firm that we work with that's up there.
I mean, we have people up there today, but like, not just the immediate, meeting with cities and meeting with this, but like, we need to think about, even state awareness, and not, and I'm not offending to our district, but I'm saying DOT, state awareness, that we want this project, or that we want this moving forward. And I again, I don't want to put you guys on the spot, but I know that it's District 5 did a Central Florida Safety Strategic Plan, which is like their version. I don't know if that's something that we can look at doing as well, with our district. Do we have anything that's like that would be sort of in line with what we're discussing?
Do you know anything about that, Scott or John?
Can you repeat what District 5 is?
District 5 did a Central Florida Safety Strategic Plan. Do we have anything that's similar to that we could like align this to?
And while you're thinking on that, there is a Florida Transportation Plan update going on that has a safety component, and we've been able to coordinate a bit with that process going forward.
What about
That's
their
at a
strategic
statewide
highway
level.
safety plan? Isn't it something that's compatible with that?
Which one, I'm sorry?
Strategic highway safety plan is produced by DOT.
Yeah, so
5-year
to answer
plan.
your
This should be.
question, I'm not aware of a district-specific
Right.
strategic plan.
Hmm.
I could look more into what
And-
District
and
5 has.
Katie is out of office, I think, today, so she's not here to answer. So let's make note and follow up with our
80 would
safety
know.
office team. Yeah. Any more bombs, Eric?
And not every city is here, right? Not every city is represented by Broward County, right? And it's
Right.
a little bit of a task too for you guys to maybe get into every single door and try to talk to staff and then even elected officials. So, I don't know if anyone else here, I mean, I have contacts with other cities and trying to work to them as well. I mean, I think we should continue this board to try to make sure that the cities who aren't represented here, that we do get in front of those commissions or those planning boards, or make a presentation or talk to staff. So, maybe there's still additional resources just besides you guys where, we might be able to help with some of those cities.
Yeah, you guys are kind of leading the charge too. So.
No, I just because, our contacts with other cities that maybe just aren't being represented in this board.
And we're going to hit on some of the coordination with other cities coming up too, and the continuation of this board. So
All right.
all these things are going to interweave with each other. So we were talking about
Rail.
how we can move forward with implementation. Oh, and then it started with Paula. That's what it was. So with SFRTA. And because FDOT owns that corridor, we will be coordinating with our FDOT partners with Unique, is it? Was it?
Rail?
Yeah, Unique
Yes.
Kelly. Yeah. And then similar, Eric, with the FEC corridor, and Karen and Rick, some of the others on that corridor. There are a number of improvements already moving forward. And so in that regard, one of Eric's comments was about why weren't there recommendations in Deerfield Beach on the rail? There are some other things already happening. And so we were looking at some places where there were opportunities that people weren't addressing yet. All right, go ahead.
Lighting is the next. I know that's close to your heart. So I think the quandary with lighting is a lot of our cities maintain but don't own, or own but don't maintain. So really it's been a struggle, and Selena did a lot of work on the lighting safety action plan, but to get in touch with FPL, and they were not responsive. So I know that was one of your big comments. So really continuing that push, because lighting is such a huge part of our safety solution. So how do we get them engaged? So anyway, any ideas? I think the main thing is having our practitioners really think about lighting with every project. Like, do we need to make sure the lights are on first? Are they LED? Are they per latest standard? Let's just get that. And then hopefully it gets the right people engaged on a project level. So anyway, just continue to think about how we can kind of get the word out. So I appreciate Eric's comment about kind of spreading the love to other colleagues. So the more information we can share, the more awareness, the more we can achieve.
And again, with our FDOT partners, the FDOT is doing lighting improvements. There was a program. Are any of you the contacts, or is it somebody else or familiar with that?
You might be the contact. What do you mean? What improvements did you hear about?
There was the state had a program and identified specific corridors to do lighting improvements. And that was through Tanya and Omid.
You could be referring to two different things.
Okay.
One is, yeah, there's a couple corridors where we're doing some lighting improvements, several. I mean, projects get programmed. The other thing I think you're probably referring to is we've been getting a lot over the past several years. High pressure sodium's harder and harder to come by. Everybody's going to LED. All the municipalities are requesting we swap them out to LED, or when they have to change light bulbs, they're putting in LED. And now we have this mishmash of HPS and LED, and they're all different colors, and it looks horrible. And when the LEDs fail, they turn purple. So now you got yellow, white, purple as you drive down the road. So Omid and Tanya, their group, are doing a systematic district-wide study to prioritize corridors. We haven't yet programmed a single project off this study yet.
Okay.
But we hired someone to say, make a recommendation to us. How would you prioritize the corridors for lighting upgrades? We are in the middle of, towards the end of getting phase one of that study. Phase one was the northern 3 counties. So hopefully management looks favorably upon funding some of these corridors. But we do intend to do the same prioritization for Palm Beach and Broward as well.
And I do think, though, that there were some locations where the lighting was already going in. So that might have been the first program.
It wasn't off of this study that
No.
you're working on.
Right. Something separate.
Yeah, like 10 years ago, Karen, remember the state had a program.
There was an intersection safety
There you go.
project that dealt with a whole bunch of intersections where the lighting was upgraded at the intersection, but just at the intersection.
Yes, that's true. That's why I wasn't,
some of all
we
the
do
different
so much
colors
with so
going
many
on.
things. I didn't know what we, many years ago, it became a statewide priority to bring intersection lighting up to a higher standard. And it was like all hands on deck. Every project is going to do this. There was separate projects funded if there was no project in the area. Yes, to bring intersections and specifically crosswalks near intersections up to a higher standard. That's largely been complete, that effort.
And the reason I wanted to explore that a little bit is we move forward to implementation. It's figuring out how does this recommendation fit, where's the best fit to make it a reality.
But I think that's a great example of, it became a priority at the state. The state funded a program and told the staff, here's your marching orders. And they made it happen. They did it quickly and it was done. So how do we piece apart all the priorities within the safety action plan like that so that we can make it all happen? Because we can't do everything right at one time. So anyway, I think it's a great example. Go ahead.
Christine, is there a page 2 of this page?
No.
Okay, so maybe we can consider to add school board to the list.
Good idea.
Thank
Thank you. Is that it? Oh, excellent.
And what's been fortunate while she's writing that down, through the different focus plans, we have had good outreach. So again, with different people at FDOT, with some different people at the transportation for the school board. So that's been different school principals. Mike?
For the rail owners, operators, I don't know if CSX kind of falls in there, but they do operate on the South Florida Rail Corridor.
Okay.
Also, Amtrak.
Yes, that's a good question. Our coordination has been primarily with SFRTA and then also FDOT as the owners. So that's something we should make sure to follow up with Unique on what kind of coordination goes on with those other users.
Okay. Thanks. All right, moving on. So the next 3 slides are how to kind of speak to different groups. As James mentioned, in January, he did a presentation on kind of how to tell the story to 3 different groups: electeds, practitioners, us, and then public. So just kind of wanted to revisit that as we talk about kind of how to get the word out and how to get buy-in for getting to zero. And a couple of questions kind of came up. Fossil and James, please jump in. But one of them was kind of the historical trends on safety is a good discussion with electeds. They don't want to hear about the details. They want to hear kind of like why, right? And we hear a lot about kind of why do we need this? And so we can talk about how obviously we have 1,000 KSIs. You can get your own metric for your area. So when you talk to your elected, you can say, I have 25, fatalities per year, or we have 50, whatever it is. A lot of times they'll respond by saying, oh, they're all drunk or they're distracted. Like that's the response you hear. And we have done the analysis. You can now use your safety dashboard to say, actually, only 14% of our KSIs are related to drunk and distracted driving. 86% are not related. And so there is an opportunity, so really discounting that, having that conversation. The other conversation we usually hear is, say if you do these safety improvements, then you're going to cause more congestion or you're going to slow down my drive. So really talking about how historically, obviously we've prioritized mobility, speed, and now we're trying to balance both mobility and safety so that we can save lives and get people to where they need to be efficiently and safely. Do we have a comment?
If I can throw in, we met with the different commissioners in Hollywood about the Taft Street project, and one of the concepts under consideration was a lane repurposing. And there were a number of questions that came up. And fortunately, our partners at FDOT had done a study on the Wilton Drive Northeast 4th Avenue corridor. I can't remember how many years ago, but there was a lane repurposing. So it went from a 4-lane to a 2-lane road. And there was a study to look at travel times. And the result shows that travel times actually improved when it was a 4-lane road down to a 2-lane. It wasn't just, though, the lane repurposing. There was lane repurposing plus then some work to coordinate the signals, especially around the Fort Lauderdale High School. And so by doing some of those tweaks and adjustments, the travel times have improved with a roadway that has less capacity. And so that's some of this, that was intriguing to a number of the elected officials in Hollywood when we talked about that. So there are statistics and information that we can give about slowing down traffic in general doesn't mean it's necessarily going to take longer. You know, there's a question of your average speed as you travel throughout and different things of that sort. So it becomes a question when you can have a conversation with the electeds and the complexity of the interrelated factors. It looked like somebody wanted to add something there.
So as we're trying to figure out who wanted to add something, for some of our municipal staff, how would you all approach these type of questions if you were asked this in a commission meeting? Because those are the types of responses or material that we want to be able to provide you all as part of that frequently asked questions when you're talking with electeds. Let's just start calling on people. Leah, how would you respond to this?
I think it depends on the specific question asked. The stats are great, and they work wonderfully as sound bites. So, it's really for us, it would be how familiar are we, and can we off the cuff give an answer to whatever the concern is.
Okay. Okay, all right, let me call on someone else. Maksud.
Thank you. I already made a few presentations to our commissions. So basically, they already have some knowledge on it. And I don't think I'll get any question that I cannot answer.
Awesome, awesome. Okay, Eric.
I have done this as well. Actually, we have some new commission orientation coming up, but with historical trends, one of the things I bring up, and it's like, you know, seat belts weren't always mandatory, baby seats weren't always mandatory, you know, airbags were not, kind of like the dates of when those things happened, and just say like this is the next evolution of safety, and that, you know, we're just continuing on with safety improvements. I've also brought up, like, you know, like this isn't like in any way like a knock to what we do, but like we've only been doing this for 100 years. I mean, like, you know, the profession itself has evolved over time, just like everything else has evolved over time. And in every single, you know, decade or generation, there's just new things to consider and review. So, you know, it's like, it's an evolving, you know, process. And so what you may have done 20 years ago isn't the correct way of doing it now, because we're constantly evolving in our research and our study, and I kind of make them want to think that like, this isn't something that's like a barrier. It's just the next step, and then kind of get them to understand that. So that's the way I typically speak to the commission.
Okay. So when I was at the city of Fort Lauderdale, and Karen can attest to this, I compared a Vision Zero to the 1960s Surgeon General saying that smoking tobacco was bad, right? So the tobacco cessation movement that started in the 60s, and really saying that, you know, we know that smoking cigarettes is really bad for you. Our target's going to be zero. We're going to get nobody to smoke cigarettes, but it's an ongoing effort that we're trying to address. So it's continuous. So yeah, Vision Zero, we're trying to get to 0 deaths and 0 severe injuries. And it's going to be an ongoing program. Just because you achieve it once doesn't mean you stop. You continue, keep putting forward the effort. And this was something that they really couldn't argue with me on, because we can all agree that it's pretty established smoking cigarettes is bad for you, and dying on our streets and not being able to get from A to B, which is the whole purpose of mobility and transportation, is also not effective.
All right, so Christina, do you want to talk about the next topic, and then I'm going to call on our other municipal partners next.
Okay. We'll just get to the next one. So agency staff, I'll start. We have the safe system approach. To your point, it's an evolution of how we prioritize safety. Thank you, Eric, for that. So we've heard, you know, that won't work here. We don't do it that way. Well, it's kind of the next, that's what we're doing now, right? So we're thinking holistically. We've heard that can cause congestion, that'll cause more crashes. So really talking to them about the evidence-based, data-based work that we've done here to support kind of arguments to both those cases. Agency staff, we have the new tools and resources. Like we talked about, we have the dashboard. We're going to creating the Safe Streets manual, design manual. We'll have the priority all the projects, the policies, the programs. We'll have all these resources available to you. High injury network map, a high risk network map. So all these hopefully will help when you're doing your annual funding or you're going after grants, you'll be able to say, hey, I have the evidence to be able to go after this grant through the safety action plan. So using that, what else? I guess what are you hearing from other practitioners is the question. Scott, did you raise your hand? Sorry, you didn't? Sorry. Karen? Mhm.
What would be helpful and timely is emergency response.
Okay.
And if there's discussion or tools to have that discussion with emergency response, because especially fire trucks, they would prefer a 6-lane road with no cars on it and no medians because they can get where they need to go. So the concern over putting medians, blocking off access to make crosswalks and things like that concerns them. And how do we have those discussions to ensure them it'll be okay? You might have to go on the other side of the median, which they're okay with, but having those discussions would be helpful because it's always a challenge.
Great comment. Anybody else?
Well, I just thought of something. So we're looking at safety, right? And data stats, and we're looking at the higher. But what about the cities or county even that's having like the least amount and then using that as a model? What are they doing? So having them at the table and sharing their best practices as well. So not only the negative, right? But what are you doing that's working in your community?
I like that a lot. There's some numbers that we looked at for different cities, like have any of the cities in Broward ever achieved 0? And there were a couple, and I'm gonna get it wrong. It was, Lighthouse Point one year had 0. And then they moved up to 2 and then 1. And so, so they've had some things going on. We wonder about, no, it was Hillsborough Beach. We're wondering about Lighthouse Point too, some of these smaller ones. But that may be one of the ways that we want to measure also with our report card is not just at a regional basis, but point out those communities that are doing better than others. As we did our analysis on the high injury network, for some reason, the numbers were worse north of 595 than south, and we're not sure why. If the people are nicer to the south of 595, if it's just different roadway network, I don't know what it is. And the crashes, there's KSIs are more prevalent like in the eastern and central parts. So, and then there's certain pattern, there's all different patterns we can pick out. So, but yeah, I like that. Make it a competitive thing to see who can do better.
Okay, I'm going to move on to our last category so we can keep moving. The last category is talking to the public. Obviously, we can talk again about kind of historic safety trends. Drunk and distracted usually comes up when you talk to the public, so you can kind of show them the numbers. Congestion versus speed versus safety, kind of same thing. Is it going to slow down my drive to get to my destination? So having those conversations about balance. How can you take action, kind of share the message is kind of the action we'd like them to take. So really telling them how we can achieve 0 through the holistic approach, and then why they should care. The whole point about 0, and I think we showed the video in January, is really that one person could be your mother, your brother, your daughter, your son. So you don't want your person to be at risk, right? So it's really about taking action, driving safe, educating. I mean, I have 3 children, 2 of them drive. So like making sure they know every day. Did you know every week 4 people die and 18 more seriously injured? You better not speed. I don't want to get comments starting to get upset. Sorry. So far they've been good. So hopefully they'll be safe. That's why I'm doing this job, right? So what are you hearing other things from the public? Questions, concerns, feedback?
And I'm looking at Ricardo, who's on the front lines with some of the Broward MPO's efforts, and maybe you've seen an evolution in how to work with the public or responses from the public over the years, as Eric was referring to that, things are evolving.
I guess, first I want to start saying that I live south of 595, so I'm in a safer area. when we started implementing projects at the NPO, one of the things that we learned pretty quickly, that we couldn't talk about the bike lane or the sidewalk. We needed to talk about the safety benefits of the projects, right? So when we worked with the local governments to really target a message based on where we were, right? If we're in downtown area, we talk about economic development. When we are in the residential area, we talk about safety, we talk about health, that's a community and things like that. And I think that's important because what doesn't, who doesn't like safety, How do you, except right here, who doesn't like safety? But I think that it's worked well for us. We got support because we don't talk about exactly the treatment. We talk about this is what you're gonna get. You're gonna get safer roads, healthy communities, economic development as a community. You have choices. We talk about prioritizing people instead of vehicles. And you get a totally different response from the community when you do that, because it's the first thing that comes to mind when you talk about a bike lane is the weekend riders, the pack of riders on the weekends that get on their ways, so they have initially a very negative response to your project. So to us, for us, for the NPO being a regional agency, working with the local governments has been key because, like working with Karen, knows exactly where the community is going to react, what resonates with your community. So that's the way we've been handling, and I think since we've been doing this for more than 12 years now, and we finally get it, and it's worked very well. So the messaging is key.
I'm reminded of a story when we were doing the 4th Avenue project with FDOT at the city of Fort Lauderdale. I had pulled the fatal crash reports for the last 5 years, and I was able to go to the public meeting, and people are saying, we don't, whatever, questioning. And I said, let me read you what happened. And I read Jennifer, 16 years old. It was 10:30 at night. She was crossing the street back from whatever, her neighbor's house, got run over, And once you start telling the personal, people just stop. Stop.
Yep.
So I think that was really powerful. If you could bring that to the, when we get down to the specific stories, bring those crash stories. I think people really can resonate. Oh, I have a 16-year-old nephew. You know what I mean? They can totally relate to that. Or my neighbor is only 16, or, they start thinking about how it relates to them personally. And then they're like, oh yeah, do it. So it really helps get that community buy-in.
I think that one of the things also, just one more thing, James, before it's the data speaks volumes to a lot of people because the numbers matter, and I think when we come to the public meetings and we say, oh, you're going to be safer, but why? Where's the data? So I think having the data, that's why I really like this dashboard here. It makes a lot of sense. It tells the story because data resonates with everybody, whether you're a community member, elected official, or technical staff.
Think of one problem that I foresee is that when we're talking with public, one great idea out of this whole conversation is trying to find a way to personalize it, right? Because if you're able to personalize it, then zero becomes more possible. And then some of the other messaging that we're trying to get people to understand, then they're able to understand it and hopefully also spread the message. Now, one thing that always comes up that I've seen in my experience is, convenience. What's the impact on my own convenience? And I feel like that's one of the hardest things to make people understand, that there might be some inconvenience, but this is what you're going to get out of it for that extra couple minutes of delay or the extra couple minutes that you're going to have to drive at a slightly lower speed. But the good thing is with this report, we do have all that data. We have all this data in all these unpublished reports that we haven't posted online for various reasons. But hopefully over the next couple of months, we'll be able to have that material available for a resource for all of you.
And I think just one of the things that's worked very well for us is having community champions speak on behalf of the projects, because a lot of times when we present, it's another government employee trying to spend some money. But when we have the community members speak on behalf of the projects, it makes a huge difference. So.
Thanks, Ricardo. Mike had a hand up?
Just, what Christina mentioned, when we were talking earlier, I was waiting for the non-municipal comment period. But I live in a municipality. Is I completely agree. Like the telling of the story, right? Putting a name and what made me think of that was when you asked the question, when you're sitting in front of an elected official and they're talking about, just drunk and distracted drivers. If those cases can be things that are, well, it's not all drunk and distracted drivers. There's people, and so if you bring the details of those stories there, then you kind of counter that a little bit and like you say, humanize it. So I wanted to reinforce what you said.
Just bring even one story.
Yeah.
I distinctly remember a meeting with the commissioner in Fort Lauderdale when we were adopting Zero, and he was discounting, just like this, right? Like they're drunk, they're homeless, like this. And I just told a story about a grandmother was driving down Sunrise Boulevard with her granddaughter at like 10 a.m. on a Sunday. And I think I said they might have been going to the circus or, like somewhere. And they were T-boned and they were both killed. And he just was like, oh, like complete, to your point. I mean, I didn't have to memorize 50 stories. Like that was one crash report. So it's not a lot of onus. I'm just saying, like, just remember one that sticks with you.
And if you could, and going back to the commercial, that's now in different languages where it says how many people, what's an acceptable number of fatalities? And he says 50, I think, and then 50 of his family walk around the corner. You wouldn't trade off one of those. So if you could make that decision. So I wanted to second what Ricardo and you said about that.
Yeah, on that subject, I have a different take on that. I think someone mentioned the message that we send out need to be correct and strong, but on the other hand, we don't want to discriminate some of the smaller group as well in transmitting the message. What I meant to say is that the data didn't really tell us for sure exactly how many crashes out there involve distracted drivers. Especially that distracted driving may have significant impact to teenagers. So we have a small group of people or drivers out there that we don't want to put out the negative information out there. We don't really care much about a smaller group. So we want to give them whole message. Safety is important to all the ages, all the people. So that message may need to be carefully transmitted to the public. I just want to make sure everyone understands. For example, when police put down the enter the crash record, indicates serious injury. Police officers are not doctors. They cannot tell one way or the other if they are truly serious injury happened. It's suspected serious injury. As long as they got transferred to ambulance, most police officers will mark down serious injury, no matter what. Okay, so there are limitations on the data. I just want to make sure everyone understands. We want to pass on information correctly and thoroughly and cover all the background as much as possible. So we don't introduce any kind of bias. I hope I make my point clear. Thank you.
To say what you actually, I've talked to several police officers, and one of the things I hear all the time is they may say something in the crash scene, but their lawyer says something different because, distracted driving shows that you're blamed, right? So like a lot of times that gets changed, that's why it's so good to do this annually because all these things change. I know there isn't a great correlation, but there are some graphs out there that show like how crashes have increased and smartphones have increased, right? Like there's stuff like that that can show distracted driving. But anyways, just back to bikes real quick. I do have a little spiel about, the bike ridership based on the brightness of their clothing. So like, if you're wearing like tight spandex and bright colors, then you're just recreationally riding a bike and you're doing that like on a weekend or like 5 o'clock in the morning, and you don't want to be on a sidewalk and you want to be in your little 3-foot lane. They want to be in the street anyways, right? Nobody wants to be in that little 3-foot lane where the only protection they have is a piece of white paint. Like it's just not a safe, it's not complete streets. It's not a great practice. It needs to be bifurcated. Like we've had that conversation, but I've had a lot of people who have complained to me about wanting to install bike lanes because they only see bikes as recreational. And you have to explain to them that bikes are a necessary resource for many people who don't have cars or, don't have other means to get around. Because I'll hear like, oh, it's too hot to ride a bike. Yeah, it is. But when you don't have any other way to get to work, that's what you have to do. Right. And so that kind of conversation sometimes has to get brought up to people about the reason for why a person rides a bike.
All right. Yeah, let's keep moving. So the last section is about implementation. So really talking about how do we get this sucker implemented? How do we pick it apart and make it happen? As we mentioned, we're going to adopt the action plan and commit to 0. We're going to amend the MTP, as James mentioned, the 2050 MTP this fall. Then we'd like, obviously, each of you to look at your CIPs and programming using the HIN, HRN, and our KSI resources. So helping give you a resource for when you're doing your city planning and you're prioritizing which projects are going to go in your next year's CIP using the HIN resources. And then we'll have the Safe Streets Design Manual that you can use to actually like implement those projects. So as a resource. Actions that came out of our plan, we've got 3 buckets: policies, programs, and projects. We've got 39 policy recommendations, 26 program recommendations, and then 57 projects identified. Year 1, first year, we need to kind of tee things up, right? So we talked about the MTP amendment, and those will be program ready. So as James mentioned, kind of going to your individual organizations and getting a resolution of support to make those program ready. The BSAP Oversight Committee will continue. As Fazal mentioned, we need to do our annual report card. So really having a committee that includes maybe even more cities, Eric, to your point, to really dive into kind of how to achieve our reporting metrics. Support our local safety action plan cities. So 4 of our cities, 1 SS4A funding for planning. So the MPO will be working directly to support after this. So to keep it going, keep the good work going. Explore resources to implement programs and policies. So taking all of those programs and policies and looking for ways to implement them through, the county, the MPO, all those different programs. We talked about maybe identifying a safety administrator position within the organizations, local budget process. So within our local agencies, programming our projects. So looking at which years, which projects. We'll have them teed up with scopes and cost estimates for you. So they'll be further along. So you should be able to have an idea of what the needs are. We'll also have our quick build projects. We'll have 10 of those, and then our 1,000 Little Things program, which is our maintenance projects that we'll be able to divvy out to each of the agencies, maintaining agencies. And then obviously we want to encourage and monitor the school safety programs in our local agencies. Any additions, James?
Yeah, if I could just add a few comments. So one of the first things that we can do on the MPO side is get some of the major projects into our MTP, which then gets that in the line for funding. And we have what we call our program ready principles, which are, there are 4 components. So any project needs to have a scope of work, cost estimates, coordination with the jurisdictional owners and local community, and a resolution of support from the commission. So let me pick one project in particular. We have 31st Avenue, Northwest 31st Avenue, that goes through 5 different cities. It's already in our MTP, but to give it more strength, Maqsood, Karen, I'm trying to think which other cities, Tamarack, Marlin. We have a resolution of support from the commission for that project, but we may want to reach out to each of the cities to get a resolution of support for that project to move forward. So that's part of that. There are other projects, so Rick or Eric, the local projects in your communities will want to talk with you about, because the consultant team will come up with the cost estimates and the scope of work, and the coordination with you all. That's the question about getting your commissions to provide a resolution of support. So that's something that we'll want to pursue with you. And then there are a number of other recommendations. And Paula, like the rail safety improvements, there are 3 projects along the SFRC corridor. You may want to talk to you about that. As we look at projects to put into our MTP, we're typically thinking about projects that have at least a $3 million price tag. And so as we come up with cost estimates, we'll want to look to see some of the rail improvements. Let's say it might be $1.5 million, or 1.5. So if we group them together, we'll get a $3 million project. So we might look at how we group some of the projects in that regard. I'm trying to think, because we had quite a long conversation about this yesterday, but there's a variety of ways that we can approach this. Oh, there may be also, and Carrie stepped out, but there may be some of these projects that are smaller and that aren't on the federal aid network. So as we've talked about some of the improvements near schools or some of the improvements in the neighborhoods based on a high frequency of KSIs, the local roads, a lot of them are not on our federal aid network. So we can't fund them necessarily with our MPO federal funding. But SU dollars, thank you. Yeah, as I realized as I said that, but there might be some other resources. So the program formerly known as C-SLIP, I think it's becoming Roads for Economic Vitality. Is that right? Something like that. Yeah. So the so there's a competitive program where our agency partners can come in and apply for funding. And those, we can use the TAP funds, Transportation Alternative Funds, for projects that aren't on our federal aid network. So as we go through each of the different recommendations, we need to understand the plug and play to make some of the projects move forward. The 2 other things we talked about, the oversight committee. So we'll talk more with you and our oversight committee members about who wants to continue on and be part of the group that reviews the annual reports. And then the support for local safety action plans. I'm not sure if you listed the cities when you talked, but 4 of our Broward municipalities receive funding to do safety action plans: Fort Lauderdale, Hollywood, Oakland Park, and Pompano Beach. And so part of their application was to show how they're coordinating with the work that we had done. The point is not to duplicate effort. So we've pulled together a lot of data, so that will be some cost saving for them. We've developed this dashboard. There are a number of other things. So we're providing the support there, and fingers crossed, Karen and Rick, the funding is supposed to be coming through because the SS4A application grant cycle should be coming through soon. So that's the latest that we heard. So but there's that coordination going on. And then also one of the things that we'll need to do on the MPO side, our 2-year budget, we start a new cycle in the fall. So some of the program and policy and different recommendations that we want to fund, we need to start getting in line for funding starting this fall. I think at the local level, county and city, you're probably in the middle of a budget cycle now. So some of these recommendations aren't necessarily ready to go forward to seek funding this year. But if you can think about how you get them in line for funding in future years. So that's how we want to break down the elements of the implementation. Christine showed all these different, what was the previous slide? How many different policies and programs and projects? So that list can be overwhelming, but if we can work with you individually to see how can we move the different pieces forward, that's what we'd like to see. And then Scott had mentioned with Jonathan how the MPO provides a list of FDOT through our MTP LOPP process, and we can coordinate that. And then let us know when that lottery is up there, the project prize giving. What is it called?
New projects for district funding leftover program, I heard.
We shouldn't have even mentioned that. It's towards the beginning of the fiscal year every year. So like May.
That's coming up. Okay.
Yeah.
And if you accidentally forget to notify us,
My birthday,
we'll
Scott. Let's
understand.
go. All right, let's talk about year 2 through 5, really teeing up, evaluating like kind of where we are in the process, what we've done, maybe doing some before counts for the corridors. So we get some really good before data, completing implementation of programs and policies. So we've got some really short-term programs and policies that we've identified in the plan. So are those progressing? Really kind of doing a checkpoint. Pursuing funding opportunities. Obviously, Safe Routes to School comes out every year. What federal grants are available? Is there SHIP funding available? Are we pursuing it? Amending our MTP with additional projects as they come up and really making sure that we're keeping that up to date. And then doing our annual BSAP report and maybe even a potential update in year 5. And then basically moving forward to policies, we have 36.
Can you go back just a second?
Sure.
Update. Just so everybody's familiar, we just adopted the 2050 Metropolitan Transportation Plan. And every 5 years, we do the same thing. We set up a scope of work and give ourselves not enough time to go in depth in all these different topic areas. And then we realize we can't do all that we want to in the limited time. So somebody on our team, maybe several people, came up with a bright idea. Why do we cram it all in a year and a half? Why don't we start doing some of these safety plans before we begin the MTP process? So we're currently starting, it's not resilience, it's infrastructure hardening. We're doing a plan so that that will feed into the 2055 MTP. In 2 to 3 years, we expect to do an update to the BSAP, probably not a major update, but probably data and revisiting some of the projects that then will feed into the 2055 MTP. Because this year, the 2050 MTP was done before the BSAP, and so they're holding a place for us. But in the future, we want to be ready ahead of time. So that's a cycle that we'll be pursuing. And then maybe in 8 to 10 years, we do a major update again.
All right, so overall, we have 36 policies. I listed some of them here. So you have a link to the Broward Safety Action Plan on the website, so I can let you peruse that. We also have 29 programs of all different sorts, from safer people to safer roads to post-crash care, as you can see. So trying to kind of the holistic safe system approach. Our BSAP executive.
Sorry.
Go ahead.
Mintang, I'm going to look a little bit to you, but some of the thing about the programs and policies, we're moving toward making definitive statements, but we're not there yet. So that's why we want to say, and even the previous one, rather than say, here's exactly what will happen, we'd rather say, we need to do further clarification of what we want on these details. And we have some time after April coming up to September where I hope we can work out some of those. And if not, we can at least continue to say, here's what we'd like to do. For example, we've had some discussion about the design vehicle for a turning radius at intersections. And how do we do? Okay, well, we're not all on the same page yet. So rather than throw that out, say, let's continue to work on that. You want to say anything else?
Thumbs up from Mintang, like it. BSAP projects, we have a lot of different projects. We obviously presented the 8 focus plans. So we've got all different categories. Overall, we have 57 projects identified, plus you can see coming soon, 10 quick build projects. So those are coming this summer. We're getting started on those. And then I've got them all listed here, all by project owner. So you can see FDOT Broward County have the longest list of opportunities. And then you can see the agencies on the right. Obviously, not all agencies are on this list. So I'm going to keep moving, sorry, so we can have more time. So like giving you an example of one of the projects from the project list. I'm going to pick on Hollywood. Sorry, Rick, you're here. So this is from our Taft Street project in the city of Hollywood. So basically what we want to do is identify all the phases of implementation. So we want to give you, here's the ultimate dream, right? With the cost estimate. And then we want to give you a short term, what can we do now? So can we do signal backpates or, LPI timing or refresh the striping or trim the trees or turn lights on, things like that, right? Like identify all those things and give the city that list. So you have the long list and the short list. And then we want to give funding opportunities, like maybe SS4A, since you're doing SS4A planning. Is there maybe another option? Is it REV? Roads, what is it? REV?
Taft Street is probably going to go through our MTP.
MTP. Okay. So like identifying and teeing it up. And then actually number 3 is taking action. So sending the list for LPIs to Broward County to do the signal retiming, sending the list for the striping to the traffic department, the trees trimmed from the Parks Department. I'm not sure who trims your trees, so.
It depends, but if you send me some hedge clippers, I'll just, and a bucket truck.
Okay,
I'll do 'em.
excellent. We'll give you some paint too. You can refresh painting while you're there. So really kind of taking it apart so that we can get things done a little bit quicker. And then obviously number 4 is program that long-term fix, right? Through those different funding priorities. So really kind of giving you those tools and those 11 priority corridors, we're going to be able to do that. The other projects are kind of already organized that way. So, because they're smaller projects. So really a lot of opportunities to do this in phases.
If I can, Scott, Scott Thurman, you don't have to say anything, but if you want though, but we're talking about some of the phasing options for 31st Avenue too. Various things are going on. And then this also ties into what Scott Peterson had talked about, that looking at how to bring in different elements. So let's pick on a stakeholder, East Broward Boulevard east of 95. There are numerous improvements that we're proposing. Do those improvements all need to go forward as one giant project, or are there certain ones that can happen sooner separately? So I don't know if you want to say anything more. Okay. Scott's having headaches about dealing with the detail. Yeah.
Excellent. All right. So what if my agency does not have a project identified? So I see Tamarack here. I think you don't have one. You have a piece of 31st. So you're in the mix, but kind of identifying what resources we have to support you if you don't have a project. So as you know, we have the safety dashboard, all the focus plans, our resource. We have all our meeting materials on our website right now that have the presentations and all the good data. All our outreach materials, as Fazal mentioned, we're packaging all those tiles and social media. We have the HRN demographics analysis portal they're going to be creating or sharing. We'll have the Safe Streets Design Manual. We're going to create a cost benefit tool for BSAP that'll be part of the deliverable with our design manual. And then we'll have the quick build guide. Will be a materials guide and then kind of show the process. So all these will be resources to inform and make sure that your projects have the right resources to implement safety. So then the next question is, what if, the mayor calls, there was a death last night on name a street, right? What can I do? So I just wanted I heard that this is kind of a concern. So I just wanted to kind of give some ideas, and I'd love to hear what you would do. So these are my ideas, but number one, get the police report so you can understand what's happening. So call your police chief, get that right away. And then maybe jump on the safety dashboard and kind of see what's been happening there historically. So you can understand if this is once, in 5-year instance, or if this is happening regularly. You can work with the police department to maybe even get a speed radar trailer put out there like right now, or a police officer could be out there doing enforcement, maybe even at the time of crash every night for 3 nights or something, so that you're showing awareness and visibility to the community. You could identify really these quick things. You could go out in the field and be like, oh, the light wasn't on, or this, the signal, one of the LED lights in the signal is flashing, or, the paint could be refreshed, or the tree could be trimmed back, so kind of doing a really quick safety audit, like on the fly, and then basically divvying those lists out to the right person, right? So send the signalization things to Broward County, the tree trimming to Rick, and, like divvy those lists out. That can be done very, very quickly. I'm sure you got somebody on staff that can jump out there and do that. You can also, number 5 is utilize Safe Streets Design Manual to explore safety opportunities and then identify quick build opportunities. I'm not sure that's the case for a lot of areas, but, if let's say there was a pedestrian crash within a 2-way left turn lane, could you maybe even put some cones out there, or delineators out there to bring awareness? I don't, so to consider quick build. What can we do quickly to bring awareness? Even just put a policeman there in the middle, like we do in our school zones. Could that help? Identify quick build opportunities, and then create modify projects to address safety needs. So basically laying out a project so that the elected official who called you can be like, oh, wow, you came up with, some ideas. And so you could use we'll have obviously all of our materials, but the design manual, I'm hoping, is going to give you kind of a breadth of countermeasures that you can consider. And then explore funding options and pursue programming for the big project. So what else would you do? Like, are these good ideas, or would these not fly? What do you guys think? This is my last slide, by the way.
I would say,
Excellent. I'd start by going there first, I guess, but I think that this is a really good list and sequence on what you ought to do to, break something down.
Thanks.
Paula?
Just add into 3 with working with law enforcement. I think as well, the community approach, like if there's a PIO or a community outreach specialist, you know, trying to engage with the public, making them aware of the danger of whatever happened. So I think, and again, I say a lot of times when you see the police, law enforcement, people, you know, they're not as open to approach. So if you have like a community event or something like that, I think that approach also could work.
So that brings up a good point. So Fazil and I have talked about this a lot with like the recent train crashes. We tend to say, right, the train popped out of nowhere, right, and hit, right? So the media tends to like kind of tell, to your point, kind of tell a story that kind of puts the burden on maybe even the incorrect person. So have you had success, maybe since you're bringing this up, like getting ahead of the story to be like, you know, we have a project in the works to add a crosswalk there or whatever, like I don't know. Is there a way to like get ahead of it to say, we're working on new gates, you know, we understand, we're doing something about it rather than
Proactive, proactively, right? Yeah, I think like the community meetings and such, you know, those are good efforts. Can we predict a crash? Maybe not. I mean, we could look at trends. And again, letting people know why things are there. When I used to do the community traffic safety meetings, I remember you said that, James, like, it's not the train. Like, people should be aware of that, you know. Hello, you can't beat the train. So making them aware of that. We could do commercials and all these different things, but people have to take ownership as well. But they have to know. Again, telling them the stories, some of them they have to be graphic, you know. So the commercials and depending on the audience again.
I'm chuckling because I don't know if it came out of Colorado where I'm from, but there was that gory cartoon of people doing stupid things on the roads and cartoon blood all over. So, but it's effective for certain
It's
audiences.
effective.
My mom would hate
It
it.
evokes emotion.
My nephews would love it. So, and Leah, not to pick on you and not to say that Miramar's, you're among the best cities, the best 31 cities we have in Broward. So make everybody feel special. 31 total, Amanda. But so, but the one of the things about this question of what if an elected official comes and says, "Oh, we have this fatality, what do we do?" Miramar is an example, and again, some of our other partners are doing this too, of a place that of a municipality that has a long range approach. So when it comes for cycles of looking for projects, the city is figuring, okay, well, this year we're doing this, and the next year, you know, so that's good. But if you get an elected official saying, "Oh my gosh, we have a crisis right now," how do you balance that plan with political expediency?
Sometimes it's tricky, but we do always try because the elected officials are supposed to represent the will of the people, right? And so we do listen and see if there's anything that we can do to expedite. And there's cases where we have. So as long as the funding is there and or if somebody wants to transfer funding in so we can get it done.
Okay.
Yeah.
So it sounds like, and I appreciate Christine, this list, and I'm glad people received it well, that it's not something happens now, you need to wait 8 years to get funding. There are a number of nearer term actions. It may, like you said, provide impetus to get funding or support for, let's try out a tactical urbanism, a quick build approach, that the support might have not been there otherwise. So, yeah, that's interesting. Yeah, this came from our last board meeting where we had a couple of elected officials bring that up. We had a crash in this location. Can we get money? And so for what? It helps to know, you know, what it's going to go toward.
How much? What do you need it for?
Yeah.
I guess any stories of like quick action success? I guess one that I'm aware of, since nobody's jumping up, is Wilton Manors. When they had the Wilton Drive, they had 2 pedestrian fatalities. What was that? Like maybe 10 years ago? And they had really heavy enforcement present. And they had the trailers out there clocking speed, and they had really a slew of officers on the drive in the really entertainment district of Wilton Drive. So we're really to kind of put a lot of effort there to show the community, obviously they were there, but also protect. So really quick action was available. And then obviously it spurred the investment in the lane repurposing and the speed management opportunities. So I think they're 0 now, but I have to check the data, but I haven't heard of any. So, but it's better.
Sorry, we can't hear you. Oh. Pull it up, yeah. You know, and you raise a good point that, so some of the statistics that we threw out in our plan, a pedestrian safety, it showed that Parkland had the lowest per capita number of pedestrian KSIs, and Wilton Manors had the highest.
Mhm.
And so it's hard to know. I hope it's not on Wilton Drive. And is it people in the community or visitors, the numbers can tell different stories, but it depends on how we want to tell it. If you can go up a couple of slides. Yeah, I just wanted to talk about here that the safety action plan, we were able to pick a few locations, a few examples. We're hoping that the examples that we've looked at will help push for new and innovative approaches. We're very pleased with our partners at the state and at the county of being open to talking about new ways. Well, they're not new, but trying different countermeasures to address safety. And so we're hoping as we start to implement projects that they will clear the way for more implementation. So if you're if you have a location that is not something that we've looked at specifically, but if you can show, hey, it's on the high injury network, or we looked at it as part of the school safety plan, or various things that can help open the way toward coming forward for projects. And so for any of the communities, and we'll give this message quite a bit, but any of the communities that have ideas for places they want to approach or projects and such, our MPO staff is available to work with you to help you figure out how to make something come out of that. Because there's different funding sources. I can't promise our funding, but we can help you look and explore ways to do stuff. There is this idea that, and if Christopher left, but the getting projects listed in our MTP, even if it's illustrative, we don't have funds identified, that will help open up the way to apply for some different federal grants. It'll show that there's a community, a regional support for it, that it's an important project. So there's a variety of different ways that we can help look at stuff.
Eric?
Just back to Quick Bill real quick. I just realized, Carmelo and Richard aren't here today, but they're so helpful when I've got an issue that, they need maybe a question about the improvement we can make on a local road or whatever. We meet quarterly now as one of our initiatives with Vision Zero. So I know that they're a big part of making this part work. So I don't know how they can be involved with the Quick Bill guy, but obviously we have to deal with them with local roads, but I mean, they're really helpful.
Carmelo is one of the key.
Yeah.
Yeah. Those individual you mentioned, with additional county staff such as Scott Sermon, they are all involved in the development of Quick Build plan. And we have gone through one review already and provide some comments. So it's under development. Right? Okay.
And I'll add that those folks are also very involved in the development of our Safe Streets Design Manual as well. So agreed, like great partners. So we can do great things. And if that's it, I think that's all I had. Yeah. Next meeting is April. We have 4 more meetings on the calendar: April, May, June, July. April, we have Oversight and Technical Committee. I might be reaching out to some cities. We might do a little bit of discussion on the safety cameras. So I'd like to kind of see how those programs are going and share the love. So
Yeah, the speed enforcement. In the school zones?
The school zone automated enforcement?
I have an update. That's not a good one.
No? Oh.
Well, that's good to know. Let's do better than
Wanna hear
Deerfield.
it? FPNL will not prioritize the turning on our devices. So we're talking about putting generators out in the short term because we can't get FPNL to do anything to help us. Even with our FPNL representatives, you know. So.
And I wanted to mention, as we go forward to the Technical Advisory Committee, Maksud, the chair, Citizens Advisory Committee and board, a lot of this feedback will help in the presentation and any questions that might come. And to be able to say, yeah, we've looked at different aspects of how to move forward. So I appreciate all the input you provided today.
Right.
Anything from our people online?
There are no questions online, and congrats everyone for not saying accent. I know Scott wanted to say it, but he didn't. So, so that's good. And then, hopefully, by our next meeting, we're gonna have a approved, BSEP executive report, so. So for the best, and if anyone wants to come to our April 10th board meeting to show a sign of solidarity and support, you're more than welcome to come into this room.
We should pick a color and all wear color or something like color of safety. All right. Thank you all.